Hello, my name's Sarah Brewer. I'm a medical nutritionist and I'm here to discuss my dental implant experience. I'm a medical nutritionist. I was a GP and then I moved into health communications and I write books and articles for newspapers and magazines. Last summer I had a rather unpleasant experience in that I had an abscess in one of my lower molar teeth. It flared up. They tried to save the tooth. I had something like 3 different root canals done on that one tooth. It was pretty full on, and then in the end it just kept flaring up again, so I had to have the tooth removed. And that left quite a large gap in the bottom of my mouth. And obviously with your molars, that's where you chew. You want something there so that food doesn't just land on the gum, and it could be quite painful sometimes. So I realised that I needed that gap filled. I had options discussed, which included a tooth that would be removable at night, a plate, that was it, a dental plate, and I didn't fancy that at all. I could have had a bridge, which would then have tied a false tooth to the 2 teeth on either side of it. And I didn't really fancy that either, because it could have put extra strain on the other teeth and caused them to flare up. And of course the best option in the end, I realised, was to have a dental implant. For me, the outcome isn't an aesthetic one as such, because I'm not trying to get a cosmetic result. It's really to have a healthy mouth and to have no problems with chewing. I don't have to just chew on one side. I had visions of the muscles on that side of my face slowly building up because I wasn't using the other and going lopsided, but obviously that won't happen. I think for anyone who's not quite sure whether an implant is for them, then obviously talk to their dentist. But if you're worried about it hurting, if you're worried about the process at all, I would say don't. I mean, it really has been an absolute delight. I mean, I only needed injections the first time when he was putting the actual implant in, and I honestly didn't feel a thing. I didn't even feel the injection, which is quite amazing. I definitely recommend anyone who has a gap in their mouth to consider having a dental implant. For long-term health of the mouth, it's certainly the best option. This gives you a dynamic implant in the mouth. It's almost like a real tooth in that it's stimulating the bone to not resorb, so you've got a very long-term healthy outcome for your mouth. My overall experience has been very positive. It was 100 times better than I was expecting. Obviously there's a bit of trepidation when you first come, you think, oh, it might hurt. And I've spent a lot of time in dental chairs in my life, and yeah, I wasn't really looking forward to it, but in fact it's been a very pleasant experience. The first visit was an assessment one. They just saw me. I met with Dr. Kelly, very lovely guy, instantly put me at ease, discussed all my options, made sure this was really what I wanted to go ahead with. And I had some x-rays taken to assess the health of the bone and the gum. And there was enough bone there for it to be done, because obviously in some cases an abscess could have damaged the bone and it might not have been possible. And apparently I didn't have quite enough gum over the bone for an ideal fit. So when I came to have the initial preparation, when the initial dental implant was being put in, he put in a little bit of collagen as a sort of stretcher underneath the gum, and then over the next 3 months that expanded the gum and allowed the gum to heal, if you like, and refill what had previously been a bit lacking. And I came back for another visit when I had impressions taken, moulds for the new tooth to be moulded, the ceramic one, and then I've just been in today to have the new tooth actually fitted, and it's just been amazing. I wouldn't even know he's been there. I've just got a tooth where before I had a hole, but there's no discomfort. It doesn't feel tight, which he said it might do. It just fits really nicely. Having reached the end of my treatment, I'm really happy. I'm really glad I made the decision. I'm really glad that I came to Bupa. I'm really glad I had Dr. Kelly acting as my dental expert. Yeah, it's been an amazing experience, very positive, and I'm very happy with the outcome.